Remember in session 1, we talked about the importance of balance among 4 areas that affect blood sugar: food, exercise, stress and/or difficult emotions, and medication. What does exercise do to blood sugar? What does food do to blood sugar? What does not eating do to blood sugar? What does diabetes medication do to blood sugar? What does stress do to blood sugar? What does alcohol do to blood sugar? Today we want to look more closely at this balance between food and exercise to manage blood sugar. Next week we will talk about starting and monitoring physical activity and exercise. If we know exercise lowers blood sugar, what would be the best time to exercise if you wanted to achieve balance? In addition, let's see other causes of low blood sugar. Causes of low blood sugar: increased exercise or physical activity, such as more than our usual activity or a change in the timing of exercise. Skipped meals, or meals that are more than 4 to 5 hours apart, or no breakfast. Eating less food than usual, such as portion size is not enough. Types of food that are not balanced, such as not following our formula for healthy meals. Alcohol use, especially on an empty stomach and if you take oral medications or insulin. This causes the body to release more insulin, which lowers blood sugar. The liver's normal metabolic functions, which help regulate blood sugar, are also affected. Timing and dose of medication, such as taking too much medication after a missed dose. What are the signs or symptoms of low blood sugar? Or what do you feel like when your blood sugar is too low? It is important to know that the most common signs and symptoms of low blood sugar can come on suddenly. They are shaky, dizzy, or weak, nervous, anxious, or feeling confused, heart pounding or beating faster, hunger, cold sweats, feeling clammy. If we don't notice and treat these symptoms immediately, some people, not everybody, may experience other symptoms such as headache, blurred vision, nausea, irritability, crankiness, or impatience, numbness or tingling in fingertips, lips, nose, or mouth, confusion or not thinking clearly, slurred speech, not sleeping well, nightmares, feeling groggy or sleepy, and unconsciousness. Different people have different signs. Many have more than one of these symptoms at a time. Some symptoms, such as headaches, blurred vision, and hunger, can also be signs of high blood sugar. Also, you might notice that symptoms of low blood sugar are similar to those of drinking too much alcohol and might be mistaken for drunkenness by others. Therefore, it is a good idea to wear a medical alert bracelet in case of an emergency so you get the appropriate medical attention and treatment. Now that we've identified some of the symptoms of low blood sugar, let's talk about the steps we should take to treat low blood sugar. Steps for treating low blood sugar. Check your blood sugar immediately, if possible, to see how low it is. If 70 or lower, continue with the next step. Number 2, eat a remedy or sugary food, such as 5 to 7 lifesavers, 3 to 4 glucose tablets, 3 packets of sugar, 1 handful of raisins, small tube of cake icing, 1 tablespoon of honey, half a cup of juice or regular soda, or the remedy you have discussed with your healthcare team. Foods high in protein, such as meat or fish, are not the correct idea, as they will not quickly raise blood sugar and can slow the absorption of carbohydrates that can raise blood sugar. Number 3, wait 15 minutes, note your symptoms, and check your blood sugar again, if possible. Number 4, if after 15 minutes the symptoms are not better or there is no change in your blood sugar level, repeat steps 2 and 3. Eat remedy food, wait 15 minutes. Number 5, if not better after repeating 2 times, call the doctor or nurse. Do not wait, it is important to get medical help. If you can't reach your medical office, call 911. Number 6, if symptoms are better and blood sugar level is back to near normal and your next meal is more than 1 hour away, eat a snack, such as a half sandwich, low-fat cheese, crackers, cup of milk, a tortilla with cheese, and so on. If your next meal is less than 1 hour away, eat a meal to prevent another low blood sugar episode. By learning what causes low blood sugar, we can often prevent it, especially by balancing our food with exercise and medication. Sometimes, however, we need to do more. This is why it is important to know when to ask for help from our healthcare providers. Call for medical help when your symptoms have not improved after following the steps to treat low blood sugar. You have symptoms of low blood sugar more than 3 times in a week, or it is lower than usual, or happening more often without knowing the cause. You need help from another person when your blood sugar is low. You do not feel well enough to take the remedy food. We'll move on to a new healthy eating subject, fats. Focusing on fat. Let's move on to the healthy eating tool in our toolbox again and discuss planning meals using fats that are good for our heart. Choosing the best fats can help keep our heart healthy when we have diabetes. Our bodies need fats to provide important fatty acids and help us absorb some vitamins and provide energy. Trying to totally eliminate fat is both extremely difficult and a bad idea. There are 2 types of fat, bad fats and good fats. Bad fats, known as saturated fats, are solid at room temperature and found mostly in animal foods. Coconut oil, however, is a bad or saturated fat, but it does not come from animals. In spite of what you may have heard, there is not yet reliable research that it has the same or more benefit than liquid oils. Reducing these is especially important because they cause our bodies to make cholesterol and increase the risk of heart disease. Hydrogenated fats or trans fats are also bad fats for our hearts and health. You may find these in processed, fried foods or in margarine. Good fats, called unsaturated fats, are liquid at room temperature and are found in most plant oils. These fats are often beneficial. Unfortunately, many of us get too much fat, especially saturated fats, and this can cause problems. Because fats have twice the number of calories as the same quantity of other foods, eating fatty foods can lead to weight gain. As we said, one problem is that bad fats or saturated fats increase the amount of cholesterol in our blood and puts us at risk for heart disease and strokes. Now let's think about how can we reduce bad fat. We can eat more poultry, fish, legumes, and beans for protein, and less red meats. Red meat usually has more fat mixed in than does fish or skinless poultry. Choose leaner cuts of meat. Trim off all visible fat before cooking. Remove skin from poultry before cooking. Eat less organ meats such as liver, kidneys, brains, and so on. They are not high in fat, but they are high in cholesterol. Broil, barbecue, or roast meats instead of frying them. Skim fat off stews or soups. Use 1% low-fat or non-fat milk/milk products such as cheese, sour cream, ice cream, and so on. Use oil instead of butter or lard. Spray oils will give you fewer calories overall. Use less butter, margarine, spreads, salad dressings, and oils in cooking and on foods. Use low-fat versions of dressings and spreads, but watch the carbohydrate content. If using processed foods, choose products that are lower in fat. Eat more vegetables and try having more vegetarian meals. Limit fast foods and snack foods like chips and cookies. Replace sour cream with low-fat yogurt. We're about halfway through our 6-week workshop and at a good point to remind ourselves why we are here. We are here to learn ways to better manage diabetes and to prevent or delay the complications caused by high blood sugar. Does anyone know what is the number one complication of diabetes over time? It's heart disease. What are some other medical complications of diabetes? Other complications include nerve damage or neuropathy, such as burning, tingling, numbness, or loss of feeling in hands and feet. Nerve damage can happen in any part of the body. Liver and kidney damage. Vision problems such as cataracts, glaucoma, blindness. Infections of the skin, bladder, kidney, gums, vagina. Gum disease. Skin and foot problems such as poor healing wounds. Sexual problems for men and women such as erectile dysfunction, yeast infections, vaginal dryness, loss of desire. All of these medical complications are the result of having long-term high blood sugar. Unfortunately, once there is damage, we may not be able to correct it. However, we can always delay or prevent further damage. This is why keeping blood sugar at a desirable level day to day is important. Many of the tools we are using in this workshop can help us to prevent or delay medical complications from diabetes. I want to say a special word about smoking. Although we do not discuss this in the workshop, it is very important for those of you who smoke that you work at becoming a non-smoker. This is not easy, but you can do it. Talk to your healthcare provider or the American Lung Association for assistance. Next, let's look at the type of tests that all people with diabetes need on a regular basis. These are listed in your book, Living a Healthy Life, Chapter 18, starting at the bottom of the first column on page 303. The first type of test is A1C. Should be tested at least twice a year to determine what your average blood glucose level was for the past 2 to 3 months. Most should aim for an A1C below 7 or as recommended by your healthcare team. If you do not know your A1C, you can call your doctor and ask what it was the last time it was done. Kidney function should be tested once a year by means of a blood and urine test. Blood lipids, fats, total cholesterol, LDL or low density lipoprotein or bad cholesterol, HDL or high density lipoprotein or good cholesterol, and triglycerides should be tested at least once a year. They may test less often if on statin medication or lipid levels are at desirable levels. Eyes should be tested once a year with a dilated eye exam. This is when they put drops in your eyes. Feet should be checked for sores at every visit, and you should have a complete foot exam at least once a year. One way you can help is to always take off your shoes and socks when you see the doctor. Check them yourself at home, too. Blood pressure should be measured at every visit. Immunizations. A flu shot recommended once a year for people with diabetes. People with diabetes should receive a pneumonia shot no matter what age. There are 2 kinds of pneumonia shots. Even if you have had one shot and are over 65, ask your doctor about having another shot, even if the first shot was before age 65. Ask your provider. Hepatitis B shot is recommended for many. Ask your provider. You might also ask about the shingles vaccine, as shingles can cause havoc with diabetes for months and is not pleasant. Teeth and gums should be checked by a dentist at least twice a year, more often if the dentist recommends it. It is important to have these done on a regular basis and for you to keep track of how you are doing. If you have not gotten one or more of these exams, remind your healthcare provider. If your doctor does not give you the results of your exams, be sure to ask.